The Urology Care Foundation is a driving force in the discovery of new treatments because we invest in research leaders. We do more than fund the best research from talented scientists. We help foster and develop their careers to support our strong commitment to finding the next breakthrough in patient care.
I just love research. It's exciting. You get to discover something that no one's ever done before. And it's really rewarding because you get these ideas. You go to a meeting and you watch a talk on something that's not related, but all of a sudden something clicks and that seems relevant to what you're working on. Then you start actually doing those experiments, and this may take 6 months, it may take a year or 2 even, and you start finally getting results and you find out your ideas were right, that you've got an idea how things work that no one knew before.
Research allows you to be able to take care of patients and answer questions for patients in a different way than if you're only clinically based. And so when you're answering questions for research, I think that helps you take care of patients better. You know, if a patient asks you a question about something, an outcome or a treatment that you may not know the answer to, you go look it up. Is there an answer available? If there isn't, then that's a research question. So it interplays so much that you learn so much from your patients, and they can help drive your career in research.
When you first start out, there's a lot of pressure to be clinically productive, and without a little bit of funding for research support, it's hard to make an argument to the institution that there's value in you spending your time on research. Having the Urology Care Foundation funding really was helpful for me in getting the initial funding for a pilot study that ultimately got me a bigger grant. And it's been a really great way for me to grow research projects and grow my own research practice.
It was awesome. It was really exciting. I remember just being absolutely thrilled, and I got a lot of congratulatory emails. I told my mentors right away because some of my residency mentors had written the letters of support. It's an award that can really change the trajectory of your career and open so many opportunities that you wouldn't have had before.
In addition, the professional network that the Urology Care Foundation offers, you know, when you're sort of brought into this family, is very valuable because you can build networks of collaborators, networks of people with resources that can help your lab in other ways. And now as I get farther into my career, it's really exciting to pay that forward to the next generation.
Mentorship has been everything in building my career to this point, and more so in what I'm hoping to shape it to be over the coming years. In a way where it's not just one mentor that put me on this path, but I think it's a combination of mentorship from multiple people, multiple different stages in their careers and multiple different areas of expertise that have really helped me figure out how I'm going to put all of my experiences together to create a career moving forward.
And we have a great cadre of mentor-mentee relationships that we have been able to foster over the last few years with the USmart program. Now we need to take it to the next level. We want to not only expand the number of mentor-mentee pairings, but also, again, enhance those interactions such that they are beneficial for everyone involved. We also want to ensure that we have a diverse cadre of mentor-mentee pairs.
People come from a variety of different perspectives, and the research that they choose to focus on depends on the perspective that they have. And therefore, in order to improve urology care for everyone, we need everyone participating in the research process to get us to improved care.
You know, seeing our work having an impact on patient, healthcare system, provider levels of care, it would be extremely rewarding, just in the sense that of all the potential sticking points of conceptualizing an idea, investigating it, pursuing it, and then translating it, it's met all those checkpoints. It just represents an idea that made it through. That possibility is really exciting. I think it's probably really exciting for most people that do research.
I love researching. Don't tell this to my boss, but I would do research for free. I like when I see the research that I've done, that I put in practice, that benefit the patient right there, many of them on biopsies, many of them on focal therapy, many of them on imaging diagnosis, and we applied it. So that's what makes sense for everything.
Here at the annual meeting of the American Urological Association, we have the distinct honor and privilege of recognizing our early career investigators who are completing their Urology Care Foundation-funded research studies this year. Please join us as we celebrate our medical student fellows, Boston Scientific Medical Student Innovation Fellow, Residency Research Awardees, Leadership in Education, Achievement, and Diversity Program Awardees, Research Scholars, and Rising Stars in Urology Research. Urology Care Foundation Medical Student Fellowships aim to expose outstanding medical students to urology research and clinical skills by engaging them in a research fellowship mentored by world-class urologic scientists. Please join us in congratulating the medical students shown here, who will complete their fellowships in 2024. The Boston Scientific Medical Student Innovation Fellowship aims to expose outstanding medical students interested in translating urology research into innovation by engaging them in a 12-month fellowship mentored by world-class urologic scientists. This fellowship provides the unique opportunity to interact with the research and development operations of the award sponsor via an organized site visit and continuing education sessions specific to the awardee project. Please join us in congratulating the Boston Scientific Medical Student Innovation Fellows shown here, who will complete their fellowship in 2024. Urology Care Foundation Residency Research Awards support urology residents in their research training and enable them to build momentum towards a career that includes research. Please join us in congratulating the investigators shown here, who are completing their Residency Research Awards in 2024. The Leadership in Education, Achievement, and Diversity, or LEAD program, is a 2-year high-impact initiative designed to support promising urology residents from racial and ethnic backgrounds underrepresented in medicine. The LEAD program engages awardees with a pathway through existing AUA research programs, enabling development of critical skills awardees can use to pursue successful careers as physician scientists, expanding urologic research and improving patient care. Please join us in congratulating the investigators shown here, who are completing their LEAD program awards in 2024. The Urology Care Foundation Research Scholar Awards identify future research leaders and ensure they receive the necessary training and support for a successful research career. These awards provide funding for 1- and 2-year mentored research training for clinical and postdoctoral fellows or early career investigators. For over 40 years, this research program has invested millions of dollars to support hundreds of research scholars, many of whom remain committed researchers and physician scientists now serving as leaders in urologic research and clinical practice. Please join us in congratulating the investigators shown here, who are completing their Research Scholar Awards in 2024. The Rising Stars in Urology Research Award provides up to 5 years of supplemental salary support to urologists who have shown significant promise toward becoming independent investigators by successfully securing a Career Development Award from the National Institute of Health or other major funding organizations. We are delighted to recognize the Rising Stars in Urology Research Award recipient completing their research award in 2024. And lastly, we would like to recognize the mentees completing their year in the Urologic Scientific Mentoring and Research Training, or USMART Academy. The USMART Academy fosters creative and impact mentorship between early career urology physician and students with exemplary established investigators. Please join us in congratulating the early career investigators shown here, who are completing their year in the USMART Academy. Please join us one last time in celebrating all these outstanding individuals and their many partnerships with exceptional mentors, academic institutions, and sponsors.